Hello? The Taenia solium has hooks and suckers, and its proglottids have fewer than 12 branches, which I will explain to you in a moment. Then we have the Taenia saginata, which only has suckers, it doesn't have hooks, and its proglottids have more than 12 branches. You might be wondering, what are proglottids? Proglottids are morphological segments into which the body of the worms is divided. We can also say that it is the body of the Taenia. Within those proglottids, we have the terminal gravid proglottids, which is where they are found. Obviously, the eggs that are going to be deposited will come out through the feces. What happens is that when we defecate, the gravid proglottids come out, and that's where the eggs are found. These will be released into the environment depending on your location, where these eggs will remain there on the ground, in the soil, where animals like cattle and pigs can go and eat these eggs and continue the cycle. What clinical manifestations can a patient with Taenia present? It doesn't present many manifestations, nor many signs or symptoms. But some patients have said that they experience itching and a sensation of a foreign body when they go to the bathroom. And this itching and this sensation of a foreign body are due to the exit of the proglottids, which are the body of the parasite. Some report abdominal pain, cramps, and nausea, but these symptoms are non-specific. And it's difficult to know if these signs and symptoms are caused by the parasite, because many things can cause you abdominal pain, nausea, or cramps. How is it diagnosed? If we have Taenia? Well, it can be diagnosed through a macroscopic exam. That is, the patient can observe what are called proglottids. What would the bodies be? As I already told you, when you go to the bathroom, you will see proglottids in your stool. That is, bodies of the parasite. They're in the toilet where you go to do your business. That would be one way to know. In case you don't see or notice anything, a stool test is done called a fecal sample. You take that to the lab, and what the lab's going to look for are the eggs. The eggs of Taenia solium and Taenia saginata are similar, but to know which type of Taenia you have, we need to observe it macroscopically, looking at the proglottids, seeing their shape and size, and what they are like. How do we become infected with Taenia solium or Taenia saginata? Do we get infected by eating beef and pork? But not all beef and all pork, but rather a certain kind of beef and pork. That is not properly inspected. That does not meet all the sanitary requirements that meat must have in order to be sold. Sometimes it can happen that these meats, since they are not very well inspected, well, there are people who really like to eat undercooked or poorly cooked meat. So there are people who like to eat steak, for example, or barbecue with meat that's a little undercooked. It's a bit raw, but some people prefer it that way. That's why I advise that everything we're going to eat should be cooked very well, both meats and vegetables. The treatment of choice for treating Taeniasis is praziquantel, which is the treatment of choice. And if necessary, niclosamide can also be used as a second option. Remember not to self-medicate. Go to a doctor so they can guide you.